Good morning, Becky. CVS Health says it sees adjusted full-year earnings in the range of $8.10 to $8.30 per share for next year. Now, the definitive consensus is at $8.24 at this point. It also forecasts revenues of $304 to $308 billion. At the same time, CVS slightly raising its outlook for the current year to at least $8 per share adjusted and $290 billion in sales. That's the top end of their previous guidance. They're also doing a return to shareholders, boosting the dividend by 10%. And here's the big shift. They're going to resume share repurchases for the first time in 4 years, committing to $10 billion in buybacks for 2022. Company had prioritized paying down debt following its $69 billion deal to buy Aetna, that deal closing back in 2018. Now, CVS's Karen Lynch kicks off her first Investor Day as CEO at 8 a.m. Eastern this morning. COVID vaccines and testing have certainly helped drive retail this year, but Lynch has talked a lot about using CVS's pharmacies and clinics as a centerpiece of a real primary care initiative, and that's going to be a big focus today, as well as the company's announcement last week that it is going to be closing more than 900 stores over the next 3 years. That's nearly 10% of the stores that they've got. Don't miss my exclusive interview with Karen Lynch later today on Power Lunch following that Investor Day. Becky?
Definitely looking forward to this, Bertha. The company's idea to close 10% of the stores, what's the reasoning behind that? Because I thought the stores were going to be kind of the forward way to reach the community and reach the people out there and make sure you could provide that health care.
They're evaluating which stores. So some stores will probably be more retail focused with just a pharmacy, and some of them are going to be these health hubs that really have a lot of primary care services. It's not going to be in every store. Certainly when you look in certain communities, not every footprint will allow that. But I think they're trying to prioritize as they try to build out this strategy.
How much of this is because of the problems with these shoplifting things that aren't getting prosecuted in some places? I know that's been a big problem for many of these stores, and that they have to lock a lot of stuff behind closed off areas at this point.
Yeah, that is one of the big questions that I have, Becky, because, you walk into any of these drugstores now and you have to ask for assistance in order to get, some shower wash or even toothpaste.
Right. It's not just razor blades anymore.
It is a big issue for a lot of these stores. It's not just the luxury stores that are getting hit up. And also there's the issue of staffing as they want to try to build out this different kind of store experience. They, like everyone else, is experiencing, a lot of competition for labor.